Thank you, doctor. And up next, we're going to ask, and I hope I'm pronouncing your name correctly, Marjolein, if you would go ahead and unmute.
Yes, hello, Ben. It is Marjolein, exactly. I'm from the Netherlands. Hello, Dr. Pai. Thank you for your inspiring lecture.
Thank you.
My question is it possible to reverse Hashimoto's and get off the levothyroxine?
So yes. So we see tons and tons and tons of, remember, Hashimoto's thyroiditis, meaning inflammation of the thyroid. So we have to look at all the things. So when people go plant-based, yes, we'll see that the TPO antibodies, the Hashimoto, one of the things we monitor, will go down. Now, sometimes in certain patients, they can go away completely, but that doesn't mean they're free of it. It just means that it's lower and they're not flaring, because some people can have a flare. So a lot of people that I see will have this history where the TPO goes up, TPO goes down, or they're not even monitored because endocrinology says once you have it, you always have it. We don't believe that. It's an inflammatory response, right? The pathology, just Hashimoto was the guy who just discovered the pathology of saying, okay, there's inflammation in the thyroid in a biopsy. So poor Hashimoto, he gets bashed every day, but it's not his fault. He was just looking at inflammation. What we look at is it could be viruses, it could be inflammatory foods, it could be stress, it could be even throat chakra. I mean, these are all sorts of other aspects we have to look at. What do we need to balance it? Now, when people have their TSH, free T3, free T4, we want to make sure that all of those are checked and their TPO antibodies, and we need to put them in the functional optimum range, not that just in the range, but the functional optimum range. We use it either levothyroxine, liothyronine combinations, or we use the Armour or Westroid or Naturethyroid or the animal one. To me, it doesn't matter. So getting the person there and making sure that their symptoms are balanced. There is a lot of natural products that we use that are clinical herbal medicines that actually help balance that. Even if people have Graves' disease, we can have help lowering that, which is quite interesting. But we're always looking at balancing the nutrition to the gland. 40% of the thyroid is functioning in the gland, and metabolism is the thyroid. 20% liver, 40% gut. So when people have any kind of gut issues, if I have a Crohn's or colitis or IBS patient and they have thyroid problems, the thyroid is always going like this, but they don't realize that 60% of that metabolism and absorption of that medication and how it's being reprocessed is GI tract. So we have to always look at all these aspects. But yes, to answer your question, now we do have patients who've been on and off thyroid throughout their life. So sometimes we can get everything balanced and they're off, they good, fine. But if something comes back and they flare again, remember all these epigenetic factors, then they can have to get back. But our goal is always to look at what's the lowest minimum dose of any drug, even the supplements. What's the lowest minimum dose that you need to have that benefit? That's more is not better, right? So always finding it, but it doesn't mean that if you are on the lowest dose that's a problem or you're not balanced enough. Is that thankfully we have actually those medications, right? And those medications have the least amount of side effects. So I use thyroid medications every day in my practice. I have no problem with that. But I look at how can I make that drug work better.
Thanks, Dr. Pai. Up next, we are going to ask Alexandra to unmute, please. Hi, Alexandra.
Hello. Hello. Thank you first for your really brave, explicit lecture on some facts on American health. It was really great to have it in such clarity. My question is, when suffering since decades from chronic fatigue syndrome, most likely due to chronified Epstein-Barr. Mm-hmm. And I've been on raw green food for about 12 years, and it did help me out of a major crash from 0 walk to half an hour walk. But last year, with the stress of COVID, fear, etc., I collapsed again. I didn't sleep and now, sorry, my voice is, I'm a bit excited. Now I was just wondering, from your experience of supplements, I mean, of course, I'm taking a lot of stuff to manage my symptoms for sleep and all organic supplements and so on. But I wonder, do you have an inspiration or idea how to cope with this potentially chronified Epstein-Barr from my early teens?
Yes, good question. What we always look at from that perspective, aside of the inflammatory aspects, which we've kind of talked about, but it's really looking at balancing the immune system, because the everybody has chronic viruses, believe it or not. We've all had, but when we see this emergence of Epstein-Barr, CMV, and other types of viruses, and some of them have increased risk of certain types of cancers. Some of them are just chronic fatigue, for example. But the viruses are usually kept and suppressed, in most people when the immune system is strong. When the immune system, so with COVID, almost everybody that had autoimmune issues or chronic viral issues had viral outbreaks. Even people who didn't even know, shingles was, last year was shingles off the charts, right? Because when we're stressed, your immune system goes down, viruses come out. right? So one of the things that we focus on is what are the things that we can do aside of the environmental factors, the food triggers, and all those other things that I talked about that are in my book and everything like that. But it's looking at what are the things now that we can help strengthen the immune system, because we have to get the body to actually kind of down regulate it, that virus that's a little bit out of control. We actually monitor those levels, so we can also see that Epstein-Barr can go up, and it also can go, just like the thyroiditis, the numbers can go up and go down. And once people go, oh, it's up, it's there, it's like, no, we can monitor, because if the patient's feeling worse, the numbers are getting worse. And so we look at things, and we also look at natural antivirals. I won't talk about it right now, but it's in my book, or you can do a consultation. And there is some wonderful preclinical data. We just had a study coming out with a phase 1 trial in Europe of an ingredient that will be very helpful. And we've had patients with not only Epstein-Barr, with even HPV go to negative. And this is surprising to me, because I'm like, what? But the body has immense ability to heal. And there's also wonderful, natural, safe, effective ingredients that can actually have an antiviral effect without actually having devastating effects. So there is some wonderful things. And I would recommend just doing a consult. And remember, I do consults worldwide. I do it by Zoom, and we do just like this conversation, and we can send testing kits, and we can do all these things, or we can tell you where to go or what to do. And so that's not a problem. I'll be glad to help you.
That's great. Thank you, Dr. Pai. We do have our next lecture coming up soon, but I wondered, are you okay for a few more minutes of questions?
Sure.
Great. That's wonderful. Thank you. Very gracious. And I'm going to go ahead and ask, let's see, Cheryl. Whoops. Let's ask Cheryl to unmute. Hi, Cheryl. Hi, Cheryl.
Hello. Hi, doctor. It's so good to hear you. Thank you for your lecture today. I have a couple of really quick questions.
Sure.
And you may have covered this to an extent. Number one, the first question is about using raw turmeric. I put like a thumb of it in my smoothies. Is that as effective as what you're talking about with the curcumin? And also, would you use the skin with that? And my other question is about the powdered turmeric. If you get an organic form, is that a safe way to get it?
So you should be. I hear an echo, but you should be taking turmeric daily in your diet. I like that. Thumb size is great. Throw it in your smoothie, or cut it and cook it up in your food. I prefer always organic. Obviously, even the powder has to be organic. But remember, curcumin is 2% of turmeric. So when you get the root, 2% of that root, which is a small amount. So like say if I take, just to make it easy math, 10 pounds of turmeric, I'm getting 2% of that as curcumin, right? So it's a small amount. It's not much. But you are getting, there's 100 other compounds, believe it or not, that are still in turmeric that are beneficial. In fact, that's why when we make our Bosmeric, even though it's 95% curcuminage of those C3, we still put in with the daily amount that is needed just to lower TNF alpha, just with the other compounds. So please take the food as you are. But is it as strong? No. But why is it not? It's because it's a natural thing. It's a food. We're not, so definitely, you want to be eating the food, but when you need breakthrough support, you need to say like, well, gosh, I'm having some other types of inflammatory responses, or having some kind of pain or some kind of disease. Then that's when we like looking at giving the Bosmeric, as we're looking at using the food as medicine. According to the skin aspect, again, the skin is the issue where unless it's organic, then I'm not worried about it. But if not, again, just get organic, because even when you peel the skin, there's still pesticides even going through the skin. Powders, no different than the raw. I just like, if you like fresh, you have fresh. If you have turmeric powder, is fine. The only things with turmeric powder or all spices in your spice rack, you should be changing them more often. So what I do is I tell people, buy small amounts of spices. Use it and buy more. But when they go to the big box and they get these big old like containers of like, here's turmeric powder and all, it's already losing its activity. So that's why like the fresh is always is better if you can. But for most people, I like just buy small bottles. Go get organic, fair trade, non-GMO. Sometimes now they say non-irradiated. There's companies will say non-irradiated turmeric powder. That's fine. You can definitely use that. But when it comes to like a headache or a back pain or preventing disease, this is when we step it up a notch and saying, okay. And remember the synergy of using all these things together, having that 20-minute onset of an 8-hour sustained release.